here with officials from Parc, that's Parc, Parc Diagnostics Limited. And I had the pleasure of meeting the CEO, who's right next to me. Come back to us. Mr. Richard Charles. Thank you, sir.
Good evening, Sheldon.
And welcome to the program. And next to him, we have Candice Chinaikan. I got it right. First try. Thank you very much. And we had to talk about Parc Diagnostics Limited. Before we get into the, as we say in Trinidad, the nitty-gritty of our conversation, tell us about this company and the marvelous work that you all have been doing with this type of technology in healthcare.
Well, thank you, Sheldon, for the opportunity to speak with you this evening and the WIN TV audience. Parc Diagnostics is a new division of Parc Group of Companies. We're in existence for over 15 years now, when we first started in the Trinidad and Tobago landscape doing supplements. Our first entry into the market was a local supplement called shark liver oil alcoxysterol to build the immune system. We've had tremendous success with us over the years with helping cancer patients, people undergoing chemotherapy, reducing the side effects of the treatment. And as the years went by, we progressed into additional supplements for different illnesses, all being natural. In the last 2 years, our company executives have started looking at diagnostic tools. And on a recent trip to Russia, we spent 6 weeks with our executives, and we were able to bring back technology from Russia that can do whole body scans, checking the entire health of the body using meridians and acupuncture points. But more significantly, we were able to form an alliance with a major corporation in Russia that has these devices being used in over 5,000 hospitals abroad. And this is the Parc Ecg, which is what we'd like to introduce. The Parc Ecg machine is a machine that can pick up the readings of a person's heart in a matter of 30 seconds.
30 seconds.
Yes, and if there are any doctors in the audience, I would like to say that we can do this without undressing the patients. They can sit in a chair, and the ECG becomes an active ECG, not a resting ECG. And normally a GP may sometimes refer a patient to a cardiologist for consultation.
Right.
With this program, we can now do an ECG with a doctor having his nurse in the same way they do a blood pressure test. They can do the test in the room, and the doctor is sitting in his office with the computer, and he logs on and he can get the report when the patient comes in for him. But the report is very different because it's full consultation. The entire reading is sorted out, a color image as you can see on the screen, and a conclusion. So one of the things we want to talk about today is how easy it is to do an ECG test with us, how fast the results are, who can use them, and why we can use them.
Before we continue, now there are those out there who are tech skeptics, whereby, they are very wary of technology. What is, for those out there who will have these questions, in all fairness, what is is there a window of error, or based on your research and where you've been and the studies that you've conducted, would you say that this is the new wave of technology in terms of determining the health of your heart?
That's a very good question. I'm glad you asked it. The specificity and the sensitivity of our equipment is far superior than traditional ECG machines. Candice Chinaikan is a specialist in the ECG field. She's our biomedical engineer on staff and medical director. I'll have her take that question.
Candice?
So ideally what we're looking at here is when we do regular ECG as a professional who was exposed to clinical procedures before, a regular ECG machine would filter out microfluctuations, or what we would see it as noise. So they would try to clear up the graphical representation of itself. What this machine does, it doesn't throw away that information at all. It uses all that information and puts that towards generating the report and giving us the image that we're looking at. So ideally, it's adding to...
So I'm actually seeing like a mirror of my heart, literally speaking.
Ideally, it's a posterior wall image that we're looking at. So there's the heart, and then what it's highlighting is the abnormality and those specific areas. So if it's that you have abnormalities in your atriums or your ventricles in any chambers of the heart, by looking at the image, that discoloration in that area and the extent of the discoloration would highlight how badly that abnormality is.
Wow. What has been the success rate of this technology? Because I know it's new to Trinidad and Tobago, so we can't determine too much here, but from what you can tell us worldwide, what has been the success rate in terms of reducing cardiovascular disease?
Well, reducing cardiovascular disease can never be achieved by introducing a machine on
Well,
its own.
true.
As you do know, cardiovascular disease is a lifestyle disease. And that brings me to the question of why test yourself for heart disease.
So you can reduce, right?
So most people would think, my family is okay, I don't have a history of heart disease, I may be as fit as you are, I may not have any of the indications that would lead to having heart disease. But why test for heart disease? Everybody is at risk of heart disease. So in the first instance, if we know that there's a trend developing with your heart, you can be proactive. You can make the changes. And why use our equipment? The European Journal of Medicine have found that the science of dispersion mapping, which Candice will talk a little later on, which is reading the alterance or the microfluctuations, is so unique that our machines are the only machines in the world that have this technology.
In the world?
In the world, sir.
Wow.
As a result of that, our equipment can do a read with 4 limb leads and get a 6 lead read. So for the doctors who are out there and anyone wanting to find additional information with regard to the techies, they can go to lookatmyheart.com and email us, and we'll also send them specifics on the references and the research that's done on this technology. So the low dispersion mapping allows us to see ischemic changes in the myocardia 7 to 50 times sooner than traditional ECG. So therefore, if we can see heart disease sooner, we can do something about it, can't we?
Definitely, definitely. So it's like you're getting a jump start to your future in terms of seeing what's happening with your heart. Now, let's go into some more detail. You just kind of walk us through what we're seeing here before we actually go and actually do an actual test on camera, so you actually see how it works. But that's from what we're seeing here. Exactly what we're seeing here, Candice.
So basically, these are the three-dimensional images, right? And as you can see here, ideally, when we look at colors, any kind of normal reading, they would regulate it with a green coloration, right? So as we're looking at the other images where you're seeing these red areas discoloring certain parts of the heart and the extent at which that color is being distributed around that particular area, we look at that discoloration. If it's deepening into like a darker purple, then it'll say, okay, that's a little more badly off, right? So ideally, by highlighting this and then doing constant ECGs, doctors are now able to look at those deviations, as we would call it, or those discolorations, if it's that they're administering medical, if it's that they're giving the patient medication,
right,
or they're trying to improve the condition. They can look at the images now and look and see if it's becoming worse, if it's becoming better, by just looking at those discolorations in the image itself.
Amazing. Mr. Charles, in terms of, now you've been in the country for a number of years, right? The technology may be new. In terms of doctors in our various health institutions, have you all had a chance to meet with many of them to discuss technology, to sort of chart the way forward in introducing this technology at our nation's hospitals? How, if that process has not begun yet, how are you all planning to?
Well, that's a good question. I'm glad you asked. We have visited the Minister of Health's office, where we saw his advisor, and we're awaiting scheduling a meeting with their chief cardiologists and doctors to evaluate our equipment.
Right.
Our initial response has been very favorable by the staff at the office, and we are currently in negotiations with a major Caribbean hospital that does open heart surgery, where they would like to consider using our equipment as part of a regional and Latin American test, where we can evaluate the use of our equipment after giving people angioplasty and different intervention procedures. Because our technology is the only one of its kind that will create a three-dimensional image immediately in 30 seconds with a conclusion, which you will see. So a person can actually be able to say, okay, we are now having a problem with our left ventricle or right atrium or oxygenation or conduction of electricity. And our system will also reveal more changes in the heart itself, unlike any other equipment today. So yes, there's a lot of potential. With regard to the acceptance of the equipment, apart from it being used in Russia, we have been able to introduce it into the Philippines and in Nigeria. And for countries that cannot afford a cardiologist on hand, or even in our country where we cannot have a cardiologist on staff at the health centers. Our approach to healthcare is to make healthcare more accessible to the population and certainly more affordable. Our country cannot afford to have a cardiologist manning a health center. So what if someone comes into a health center? What if they had a chest pain? What exactly is the nurse to do? Now, if we man each health center with one of our machines, and the government assigns one head cardiologist by region overseeing 10 or 20 health centers, what can happen then is that this health cardiologist, the head cardiologist, stays here with his laptop. When the nurse or the practitioner does a test and we see a conclusion indicating immediate consultation necessary, okay, they text the doctor, doctor, log on, review this file, and right away a doctor can make a determination in real time without being there.